So I wanted to explain how ACE inhibitors worked, and I think the thing that helped me understand this the fastest was just to think of sodium increasing blood pressure. So as soon as sodium increases, and I'm talking about in the blood and in the body, blood pressure increases. And I think of this in terms of if you have more salt in a solution, it's going to draw the water from other areas. So if you have more salt in your blood, it's going to draw more water from the rest of your body into your bloodstream and therefore increase your blood pressure. So the next step to understanding this whole process about how ACE inhibitors worked is just to understand the renin-angiotensin system. So I'm going to quickly go through that now. And the story sort of starts over here. I'm sorry for my terrible drawing, but this is a glomerulus. And if you remember, this is where blood filters, or things filter from your blood through the glomerulus and across the basement membrane and into your nephron. So this is stuff in your blood, and then it filters out, and this is essentially urine that passes down there into your bladder. And these little dots here represent the juxtaglomerular apparatus. And these juxtaglomerular cells essentially sense sodium and blood pressure. So as the sodium falls in these cells and the blood pressure falls in these cells, they produce an enzyme that's called renin. And renin is an enzyme produced in response to those from the juxtaglomerular cells. Now this is my representation of a liver, and inside the liver sits something called angiotensinogen. And it doesn't really do much until renin comes along and converts it into angiotensin I. So without renin, angiotensin just sits in the liver doing nothing. When renin is produced in response to this, it converts the angiotensinogen into angiotensin I. Now angiotensin I doesn't really do much, just sits in your blood floating around until it comes into contact with something called angiotensin converting enzyme, which basically does what it says on the tin. It comes from the lungs, it sits in the lungs, and as this angiotensin passes through the blood vessels in the lungs, the angiotensin converting enzyme turns it from angiotensin I to angiotensin II. Now the angiotensin II is important for a number of reasons. It actually does something. So this is the key part. Now it does a few things, but all of them essentially amount to an increase in blood pressure. So the way it does this is it acts directly, firstly, on the thirst center. So it increases thirst. Now if you increase thirst, you drink more water, and that water has an effect to increase the volume in your blood. So essentially increases your blood pressure. So it accomplishes that way. The second thing that it does is vasoconstriction. So the angiotensin II vasoconstricts your blood vessels, and if you constrict them, you'll increase the pressure. So in that sense, it increases the blood pressure. Now the third thing it does is it acts. This is my little drawing of a kidney, and it's wearing a hat, and the hat is essentially the adrenal cortex. And on the outer layer of the adrenal cortex, which is called the glomerularis, just to complicate things, is produced something called aldosterone. Now this is another aldosterone. Now this aldosterone acts on the kidneys, and it acts on the distal tubules as they come past, and it causes reabsorption of sodium. Reabsorption of sodium from the nephron, or from the urine essentially, back into the blood. So by doing that, it increases the sodium in the blood and increases the blood pressure. So this clever system essentially takes you from the juxtaglomerular cells sensing a low sodium and a low blood pressure through a number of different steps to increasing your sodium and increasing your blood pressure. Now I've already established that the renin, the angiotensinogen and the angiotensin II don't particularly do much in this system. They're just steps along the way. It's only when you get the action of the angiotensin converting enzyme to convert angiotensin I to angiotensin II that you end up with all of these effects that end up increasing sodium and increasing your blood pressure. So if we can block this system with the ACE inhibitors, you then block this pathway and you block all of this from happening, and so you don't get an increase in sodium, you don't get an increase in blood pressure. So you're just left with this system. And as a result, ACE inhibitors work to reduce your blood pressure and reduce your sodium. Simple as that.